A hospital at the center of a child HIV outbreak in Pakistan has been caught reusing syringes during undercover filming. Families of affected children believe the infection was transmitted through contaminated injections during routine treatment at a government hospital in Taunsa in Pakistan's Punjab province. The children are among 331 cases identified by an investigation by BBC, where minors tested positive for HIV in the city between the November 2024 and October 2025. The outbreak was first linked to Taunsa Hospital by a private clinic doctor in late 2024, after which local authorities promised a massive crackdown and suspended the hospital's medical superintendent in March 2025. However, a BBC Eye investigation has now found that unsafe injection practices continued months later. During 32 hours of undercover filming in late 2025, investigators saw syringes being reused on multi-dose vials of medicine on at least 10 occasions, a practice that could contaminate the drugs. Health workers and doctors familiar with the cases say most of the affected children had received treatment at THQ Taunsa. Data gathered from provincial screening programs, private clinics and leaked records suggest 331 children tested positive for HIV. Out of a sample of 97 infected children whose families were also tested, only 4 mothers were HIV positive, suggesting that most cases were not caused by mother-to-child transmission. However, the local government maintains that there is no conclusive epidemiological evidence directly linking THQ Taunsa to the outbreak. The investigation also highlights broader issues in Pakistan's healthcare system, including over-reliance on injections, unsafe practices and shortages of medicines and supplies, all of which increase the risk of infection spread.
A secret investigation involving hidden cameras has uncovered alarming breaches of medical safety at a government-run hospital in Pakistan. Footage of over 32 hours inside THQ Hospital Taunsa showed repeated violations of basic hygiene standards. Data compiled from provincial screening programs, private clinics, and leaked police records identified at least 331 children in Taunsa who tested HIV positive between November 2024 and October 2025. Further analysis suggested that most infections were unlikely to be transmitted from mothers. Of 97 families tested, only 4 mothers were HIV positive, pointing towards other sources of infection. The investigation found healthcare workers reusing syringes across multiple patients and drawing medication from shared multi-dose vials before administering it to different children. In one instance, a nurse was seen reusing a syringe containing leftover liquid, a serious violation of safety protocols. Staff were also observed administering injections without gloves and failing to properly dispose of medical waste. The case of 8-year-old Muhammad Amin, who died shortly after testing HIV positive, highlights the human cost. His mother said his final days were marked by severe fever and intense pain. Soon after his diagnosis, his sister Asma also tested positive. Their family believes both children may have contracted the virus through unsafe injections during routine treatment at the hospital. Despite earlier promises of a massive crackdown and the suspension of the hospital's medical superintendent in March 2025, the investigation found that unsafe practices continued at the hospital. However, the newly appointed superintendent questioned the authenticity of the footage, suggesting it may have been recorded before his tenure or fabricated, while insisting that the hospital remains safe.